That was my first time. That was my first trial. Unfortunately, I didn't pass. I think the main problem at that time, I wasn't prepared well and I was hesitant, more or less. Regarding the second trial, the one that, Alhamdulillah, I take one-to-one coaching with you in the course at the end of my preparation. Actually, in Egypt centers, there is two centers actually in Egypt, in Cairo. The one that I took place with is Al Qasr Al Aini. It's related to university. Yes. In Al Qasr Al Aini, the five station, uh, the people there, they are more polite because my first trial was in military hospital. I don't know why. In the military hospital, they were tough as even the cases, sometimes they bring chronic cases there. So they become tough in discussion and tough in other issues. But in Al Qasr Al Aini University, I think they are more or less more polite. The cases is mostly half and a half. Half of them was chronic and half of them was acute cases. Regarding preparation, I took courses in Egypt on site. I took with the mentor, Dr. Ramadan. Anyone came to Egypt, for sure he hear about it, about him. Yes, I took with him three courses: preparatory, advanced, and mock. And he has a long story, and he's teaching for OT for MRCB since 2001, I think. This regarding the on-site. Online, I took with you the one-to-one coaching, the course, and really it's arranged for somehow my thinking. The other thing that you are giving people space to talk. Most of the mentors, they are enforcing you to say what they want. This, I think, one of the main problem with the mentors outside. You are given time, you are accepting, you put the person in the actual exam. And this helped me a lot, really, because I think one of my weak point was how to present and how to say your finding. I catch the finding because I take this on site. I see a lot of patients. But the good thing, when you are having mentor like you, mashallah, Dr. Nasim, you are give someone confidence to talk, to have the opportunity to say whatever. Then you are correcting the most serious issue, not everything. And this is a good thing. And this is the actual exam. Actual exam, my experience, they are looking for the skill. They are not looking for the knowledge, the deep knowledge. They need only you to find the finding and not to invent any finding and to arrange only the finding. This the main issue regarding the exam. And actually, even I think in my exam for station 2 and station 5, for station 2, I got 27 out of 28. And I didn't reach to the actual diagnosis that they want. I gave a differential diagnosis. I think the diagnosis that they was looking for bronchiectasis with hepatosplenomegaly and amyloidosis, bronchitis and amyloidosis. I say only fibrosis and separate. I say when he asked me, is there any relation to him? I couldn't find any relation. And he gave me 27, but I find the physical sign, all the physical sign, alhamdulillah, I got all of them. The other station was normal patient, and the station was hypercalcemia post chemotherapy session. And even though I'm an ICU at that time with the stress, I forget how to manage even the hypercalcemia well. it's my pure work and it's my normal. At that time with the stress, I was distracted, and he gave me 28 out of 28. So they are not looking for the
yes.
actual. Yes.
They know it that candidate in the stress, so they are not looking for deep knowledge. Superficial knowledge is more than enough.
Yes, this is my
അകത്ത്
experience.
അരിയുണ്ട് അത് വായിലോട്ട് പോകും, അത് പൊട്ടിച്ച് തിന്നു മോളെ. അല്ല അതിങ്ങനെ ചവയ്ക്ക് ചിലപ്പോ അകത്തോട്ട് പോയാലോ കുരു.
Continue, doctor.
This is my experience, and if anyone is taking exam in Egypt, I can leave my number in case they need any help, any support.
Dr. Majid, one Dr. Ahmed asking, can you tell me the top 5 cases in clinical station?
In clinical, actually there is nothing is called top 5 actually, but there is a big lines that the big topics that they will ask about. Usually for me in the cardio it was mixed aortic valve and missed aortic valve, and in addition there was mitral regurg that I didn't mention in the exam, but I got 18 out of 20. So they are looking, yes, they are not looking in the exact diagnosis.
Correct. And what are the cases, means your experience coming in cardiology or respiratory basic, just like I came to know that the COPD is very common in Egypt, correct?
The COPD is common. Also, the cases of pneumonectomy and lobectomy, there is a cases also for chest. Also for chest cases, fibrosis.
Yes.
There is fibrosis. There is, and my station 2 was case of fibrosis. That fortunately I saw it before, and alhamdulillah. I have some experience about it, but there is variety in Egypt. But if you go step by step, you will catch for sure.
And chronic hemolytic anemia is also common.
It's too common. Thalassemia and chronic anemia is too common. And my case was also thalassemia and hepatosplenomegaly. And they were looking for a differential diagnosis. Yes, I got it, alhamdulillah.
Okay, very good.
I got 20 out of 20, alhamdulillah, in abdomen.
So, and what about this Egypt center? Some candidate are just want to know, some texted me personally that means when you are talking to the surrogate, the patient is in front of you or they are in the somewhere else. You cannot see the patient while talking to surrogate.
Actually, in Al-Qasr Al-Aini, where I took the exam, they said to me that sometimes the patient is hidden, but in my exam, no. In the 2 station 2 and 5, the patient were there, but like they are in my back. But when I enter the room, I saw him in my left hand, but he is in my back. And when I talk to the surrogate, the patient in my back, I cannot see him well, but I can see him when I enter the room only.
Okay. So I think better to see the patient first, then start conversation, correct? Because then otherwise you will not able to see again, correct?
Actually, the patient is far from the entrance of the room, so they will catch you directly and put you in front of them.
Here's the upper face. No, upper motor.
Okay. Continue, doctor. Yes.
Okay. You cannot go to the patient. Patient is is far in the other part of the room, and when you enter, they will say, "Come here, sit." They will not let you go there. Yani.
Okay.
They are old folks, Doctor Nasim.
So very good, doctor. So any tips for my candidate, those who are preparing for Diet 3? Your tips particularly at the day of exam or few days before the exam, what they need to do, as per your experience?
Okay, actually, they need to relax first. This is the most important thing. You need to. It's difficult, and I cannot say that I was relaxed, but this is the most important thing. Relax when you talk to the patient or to the examiner. Be confident. Don't be hesitant. Even if you know the knowledge, if they show you as hesitant, they will cut your mark. They need someone who is confident, and for sure they are helping. some of them is must face for sure, but at the end of the day, I think all of them trying to help you. Yeah, even in my case in neurology, the examiner was mask faced. I was thinking that I failed the station. It was the hemiplegia in young that I practice a lot, and I practice with many people, online and offline. But in the exam, I get confused sometimes. I forget even to look for the cranial nerve, and I think it's crucial to localize. But I forget about it totally. And Alhamdulillah, I got 20 out of 20. So missing one thing not mean missing the whole station. They are
correct.
helping. They are not attacking us. This the message, and everyone need to be relaxed. For if anyone in Egypt in Al Qasr Al Aini, please go try to look for the place before you go, because even if you go by taxi or to reach to the place of the exam, you may walk like a kilometer or half kilometer. It's too far. So try to, yes, this Al-Qasr Al-Aini is specifically, you need to go early. If you can go one day before to look for the place, it will be better. Because there is a long distance that you will walk, and you will feel walking and stress. You need to reach it. So if you have this, Alhamdulillah, before my exam by 4 days, I went there and I see the area. So
this is the general advice, I think, for everyone, that
yes,
visit the center before your exam.
yes, go early, and there the registration process is simple, like everywhere. They are not complicated. They will take your phones, everything with them. You will finish your diet, 5 station, and you will go directly. There is no obstacles. But the issue, you need to go early to be prepared.
And I think, Dr. Majid, you pass from the not a good center, comparing the Almadi. Okay.
They are saying that, but Alhamdulillah, I pass.
Yes.
Someone is asking,
Everyone.
is new? He asking, is new Qasr or old Qasr? Actually, the center before there was, they are saying the French Qasr Aini, Qasr Ain Faransawi. They shift the exam to Al-Qasr Al-Aini Al-Ta'limi. It's another center. So better if someone new to Egypt to ask and to go one day before to look exactly where the exam. And I will leave my number in case he need any help. He can contact me.
Okay. Thank you so much, Dr. Majid. Okay.
Welcome,
If
welcome.
anyone want to talk to Dr. Majid or any help, you can talk to him directly. You can send me in the group. I will send his number also. He's a very helpful man. Okay. So thank you so much, doctor, for coming. Last time we miss you. Okay.
Thank you.
There is a one
At that
doctor
time,
there from Almadi. So there is a one doctor there from Almadi. So hopefully, if he will join, we will discuss that center also.
Inshallah.
Yeah. Okay. I think acute real cases. So they are asking the surrogates are also there in consultation, or only real cases?
All the station there is a surrogate, because all the patients are Egyptian. They are not talking English. So each station there was a surrogate, and they are talking. They are really professional. The one some of them of top, but all of them they have clear language. If someone has an affiliate from the language, they have clear language, and one of the examiner will be local, and one from UK. Yes.
Yes. Okay, Dr. Majid, thank you so much.
Welcome. Thank you, Dr. Naseem.
Okay, so we will meet one Dr. Abdul Hadi. He passed from Madi. Okay, so he will join after 15 minutes, I think so. Thank you so much, doctor.
Welcome.
Okay. So if anyone has any questions for Dr. Majid, he will answer you. Just you need to write down in the chat box. In between, I want to invite, I think, Dr. Tauseem, are you there?
Yes, sir, I'm there.
Big congratulations, Dr. Tauseem. How are you?
Thank you, sir. I'm good. How are you?
How you are feeling now? You
Good,
are so
relieved,
before
sir.
your exam.
Yeah. True, I was so tensed.
So she passed from UK center. So doctor, you are appearing first time?
Yes, sir, first time.
Yeah. Okay, so very good. Many congratulations for
Thank
passing
you, sir.
from
Thank
UK
you.
in the first attempt. Okay, so it's
Thank
a
you,
great
sir.
achievement. So we just want to know from you, Dr. Tausim, your experience. You appear in the UK. So for those candidates who are planning to appear in UK, just can you share your tips? Okay, how you prepared
Yes.
and what the things they need to do.
Yes, sir. I basically, I think, prepared for around 6 months. I had subscribed to the past test videos, so I used to watch the videos. So I was used to see how they examined. I used to see how they presented, and also what was the question and answer session. How was it? What questions were asked? So I used to take notes of that. And the main thing I did is I used to practice. I used to practice examination with the timer. So as far as possible, I used to go to the wards, see patients, and used to practice as much as I can. So I won't say every day I did, but I did as much as I can. But I think close to the exam date, I was doing more frequently. So I probably 2 weeks before the exam date, I was doing one every day. So that's how I practiced examination. And then comes coming to the books, I only refer to Cases for Paces. I think that's one of the best books. So I did that. And again, to the courses, I would recommend everybody Dr. Nasim Huda's class. That's really commendable. So I did his class. So I remember, sir, when I joined, I didn't actually have a date with me because I was on a waiting list in Diet 1. That's when I first approached sir. And sir didn't have any active class at that moment. And he was kind enough to do sessions with me then. And then when he started his regular classes, I joined again. That's when I did his class for the first time, 4 weeks. And I think the commendable part is how he teaches you. Even if you say a normal thing, a very simple thing, he will say very good and excellent. So I think that is something that keeps us going. And again, you will be corrected if you have said something wrong at the end. But as mentioned by the previous candidate, he will always patiently listen to you till the end of the session. So that's something really great about sir and how he teaches. I think that's something that everyone who has taken class with Nasimullah sir will say. So that was there. And after that is when I got my dates. So I remember asking sir to join as a listener. But then again, because of my tension, because I don't have a medicine background, I'm a dermatologist. So I again participated actively, and sir hasn't even asked for a payment. So I think even that shows how dedicated he is to his students. So thank you so much, sir. So that's with the consultation and the communication sessions how I learned. And I also attended the classes, the workshop classes. So I attended basically 2 classes. One is Past Spaces, which is quite famous in UK. So I think everyone would know. It's usually conducted in London by Dr. Rupa Pesant, and I think it's one of the best classes that you can attend. And it's a 4-day session again, where they show you a lot of clinical cases and demonstrations. And since I had a difficulty with the neurology stations, I also attended a course called Neuropaces, which is being conducted at the Walton Neurology Center in Liverpool. So if any candidate who's finding it difficult with the neurology, I would suggest that, because they actually show really good cases, and they help you and guide you on how to diagnose the neurology station and all. So that is something that I would recommend. So this was the basic preparation methodology which I did. And I feel while you practice your examination, even though when I was practicing examination, I finished within 6 minutes, but I feel once you're in the center, like in the examination scenario, what I felt is I just completed. I used to complete in like around 4-5 minutes, but even then I found it difficult to complete in 6 minutes. So I would say always practice to finish your examination earlier, because I think on the exam day, due to the stress and everything, it's really hard to finish it really quickly. So you need to practice really well to finish it on time. So that is something that I would suggest everyone, and then practice presentation. And coming to the Q&A session, which you will experience, from the experience that I had from the exam, what I felt is they are not going to ask a lot of in-depth theory to you. So if you practice really well how you examine, if you practice really well how to confidently present your findings and then come to a diagnosis, I think that carries a really good mark. And then the Q&A is not very in-depth theory. So I think they're basically trying to see if you know the basics, not like too detailed. So I feel that don't spend too much of time learning a lot of theory. I think that's not doing much good. Practicing a lot of examination, presentation, and a moderate theory, I would say, is going to help for the exam.
Basic knowledge,
So
means basic knowledge
exactly.
about.
Yeah, exactly. So, so that is some of the things which I have learned from my experience. And coming to the exam center in the UK, as mentioned by the previous candidate, I feel everyone is actually supportive. Like, again, as said before, not everyone will note to your answers, but they might keep a masked face. But at the end of the day, they might prompt you. Even if you don't say the answers, the direct answers, in a first go, they might prompt you to say the answer. So I feel they are really helpful in that way. And so that's my experience. And they actually, even the people who were conducting the exam, were actually very supportive. So they were telling, like, don't worry, you know, to relax. But I would say it's really hard to relax on the day of the exam. Everyone can say, but it's not very practical. So everyone will have stress and tension for sure, but I think maybe we can try and reduce it a bit. That's all what we can do. I still remember my first station was neurology, which is again one of the toughest stations for me. But then I was literally shivering before I was entering the station. And one of the things is I couldn't do coordination, and actually I couldn't complete my examination. And I couldn't actually check plantar also. So I thought maybe they will mark me down a lot because I didn't do that. But I was sure my diagnosis was correct because it was Charcot-Marie-Tooth disease. But in the results, I actually got full marks. So I think they are basically seeing how well you're doing the examination, what you're doing. And if you can really convince them, why you made the diagnosis and how you would manage the patient. If they understand you're a really good candidate, and even though you miss like one or two bits, I think they are going to forgive that. That's what I feel from the experience that I've got.
Yes. So there you are talking directly with the patient, correct?
Yes, sir. There we are talking directly with the patient. Yes.
Okay. In every station, there is no surrogate?
No, sir. In every station, we are talking directly.
Okay. So how do you feel? Means it's okay. They are
yes, sir.
trained?
It's okay.
Okay.
Yes, sir. They are really well trained. One thing that I had a fear of is like, will there be any problem with the accent and how they speak? Will there be any problem to understand? But I didn't face any of those. So it was very clear. Whatever they spoke in the communication stations was really clear. And I have heard from my fellows that sometimes they don't say any complaint and it's hard to come to a diagnosis. But in my exam, actually, I didn't face any of those. I think it depends on how well trained they are as well. So from the exam center that I did, I actually did not face any of those problems. They clearly told what their problems were, and they were responsive to what we were telling. So it was more easy.
അമ്മൂന് എന്താ പറ്റി? അമ്മു ഷീറ്റൊക്കെ എടുത്തോണ്ട് വെക്കുന്ന ആൾക്ക് അവിടെ വെക്കാൻ സ്ഥലമില്ല മോനെ. ബാ ചോറുണ്ടോ?
So the takeaway message is that we should not read much, correct?
Exactly,
no,
sir.
Means deep knowledge is required. You need to practice, correct? Practice.
Exactly, sir. Yes.
Okay. Any other
I would
tips?
say, yeah, practice, really good practice on completing your examination within the time, and to present, how to present with confidence, and then about the theory, but not too deep. This is what I feel you need to learn on.
Okay, Dr. Tosim, thank you so much
Yes,
for
sir.
joining.
No problem. Okay, sir. No problem. Thank you so much.
I will check anyone has any message in the chat
Okay,
box. I think no one has any message. So thank you so much, Tosim, correct? Yes,
thank
for
you,
coming.
sir. Thank you so much to you too,
To
sir.
us. Okay, we are talking after some time. Okay, keep in touch, Dr. Tosim.
Oh, sure, sir. Sure, sir.
Okay.
Okay,
Thank you
thanks.
so much.
Thanks.
So I think the Dr. Pranam, are you there?
Yes, sir. How are you, sir?
Fine. Many congratulations, Pranam.
Thanks a lot, sir.
How you are feeling now?
Sir, I'm just on top of the world.
You passed from Thiruvanantpuram, no, doctor?
Yes, sir.
So can you share your tips regarding those who are going to appear in Thiruvanantpuram? Many candidate might got a seat and
Yes,
they
sir.
are here. Okay. So your tips for this center and how to prepare, how you
Yes, sir.
prepared for the exam. And briefly, just.
Yes. Yes, sir. Sir, actually, it was a bit more challenging for me as I'm from a dermatology background. So I needed to go through some common theories which are common for rest of the candidates, but I had to start from the scratch as I was from a dermatology background. So
So you are the second dermatologist today.
yes, sir. So, sir, I think it was a bit challenging for me at the beginning, but actually, sir, it's all about practice. I will say that the more you practice with your partner, the lots and lots of patients you see, and the confidence you show in presenting the cases, I think that's the key, sir. It's not about the depth of the knowledge, as the previous candidates have already told, and it's not about how much you know, how much you know at the molecular level. It's not like that. You have to just if somebody wakes you up from the sleep, and if anybody asks you about tell some causes of hepatomegaly, or tell some causes of this, then you have to get those answers ready in your mouth.
Chest pain
Yes, sir.
causes. Chest
Yes,
pain
sir.
causes. Chest
Yes,
pain
sir.
causes.
Chest pain causes and shortness of breath.
Yes.
You know everything, sir.
Yes.
And sir, about Thiruvananthapuram, I want to tell that those who got seat in that center, I will say that they are very much lucky, as the center is excellent. According to in terms of time, in terms of candidate friendliness, they are just top notch. There are uh, 3 or 4 persons for one candidate in one station. They are working so that in such a coordinated way, so that each candidate can utilize 100% time that is given to him or her. So there is plenty of time in each station. I had finished my examination before time, and it's an excellent center, sir, and they are there to make you pass, and nobody is going to fail you unless we make very much I don't know, but it's all about luck also. There are some facts like sometimes a very good preparation can also make you fail, but we have to give our best. And so another tip I want to tell that if one station is not up to the mark, please don't carry the burden to the further stations, because 1 or 2 stations will not make you fail if you don't make a very much brave mistake. So, so that's all, sir.
Because 1 or 2 candidate who did not clear the exam due to 1 or 2 marks, they are also happy with the center. They are telling
Yes,
that
sir. Everyone
they
is
will
happy.
apply again for that center. So this is a very good feedback. Correct, na? Those who
Yes,
clear,
sir.
they're definitely happy for the center, but those do not clear, despite that they want the same center again. So it
Yes,
is
sir.
something very good. And as per my feedback also from different candidate, I think this is one of the best center in India. I think you do not find any language problem, correct?
No, sir, there's no language problem, and they speak clear English. And I think they are not bothered about which differential we told first. They were bothered in the respiratory center, but in abdomen, there was massive splenomegaly. So somebody told CML first, somebody told thalassemia or hemorrhagic anemia, but they took all. They didn't deduct any mark for the differential. And
Yes.
sir, I will suggest to the candidates that please try to grab a good partner, because I had a very good partner. Unfortunately, she didn't pass from the same center for just only 1 mark. But actually, without her, it wouldn't have been possible for me to pass.
Yes, partner is
So
very good. Means partner is
managing
the
a good
main.
partner is like managing a good mentor.
Hmm.
Apart from sir, she also helped me in every sector. So I think a good partner is also a very key to success.
And after exam, how you are talking, Dr. Paranam, with me? You remember?
Sir, I just I wanted to cry,
It's
sir, at that time.
a very
Sir,
difficult to judge exam.
yes,
It's very difficult.
yes, sir.
Sometimes examiner good, even means they know that the candidate are tense, means candidate is in the stress. So most of the examiner try to help.
So I was in a very much difficult situation, as my first 2 stations were bad. The first station was a respiratory station, and it was they were trying to hear bronchiectasis from me, but it was very fine preps, and none of the 5 candidates told bronchiectasis. Somebody told ILD, somebody told pulmonary edema, and it was a patient with a abdominal scar, renal transplant scar, with a active dialysis in the hand. So I was first confused. I asked my examiner that, am I doing the respiratory station? I was confused that is it the abdomen station? Then they told, no, just auscultate the lung. Just do your respiratory examination. Then I just proceeded with that, and I told ILD first, but all the questions were from bronchiectasis. So then after that, there was a communication, which was a counseling about pneumothorax, and sir has made us practice the case of pneumothorax several times. So I think it will cover from the preparation. Then the second station was a young man with shortness of breath, and inside there was a very a boy who makes his body from the gym. It was a healthy man, and on examination there was no finding, but I was so much puzzled, as my first differential was pulmonary embolism, but I couldn't find any positive findings for that. So I just made a disaster in that station. I couldn't bring out any positive history from the surrogate, and they just show me a drug name. It was in trade name, not in generic name also. So I was really confused, and I did a massive disaster in that station. And in the following station was my cardio and neuro, and I was just thundered that what am I doing? I'm not serious about my exam. I was sure that I'm going to fail, but by God's grace, I didn't take that feeling to the further stations.
So that is the key.
And
Na? Means one
yes,
station
sir.
did not decide the exam result.
Yes, sir. So the cardio station was a mitral regurgitation, and it was not obese, but a high BMI lady, and I couldn't find the apex beat. There was no murmur in throughout the lung field. Heart precordium. And then when I saw radiation, I found radiation in the axilla. Then after that, when I again tried to auscultate the apex, and then I found some faint murmur in the apical region. So it was mitral regurgitation, and that station was correct. And after that, I went to the neuro station. It was a case of peripheral motor neuropathy. So there was plenty of time after performing each and every steps. and there was no hard questions. It's, some easy questions, some differential investigation. How will you manage the case like this? Then the next station was a communication. There was a depressed son who we had to counsel him about why his mother died. His mother died from metastatic carcinoma, and he came to just fetch the death certificate.
Yes,
So we just had to counsel the
I
depressed
think we also practice
son.
this with you, no?
Yes, sir. We also practice that, and we just needed to hear him because he talked for 3.5 minutes. He just talked, and I just listened, and then I focused on his mental health and about how his family is doing, and what if anybody was dependent on his mother. Just these common questions that we ask in these type of scenarios. And then I moved on to the abdomen station, as I have told that it was a massive splenomegaly. And the differentials, each candidates just told the same differentials, but the serials were different. So I think they took it all, because I didn't tell leukemia as the first differential, but they didn't deduct any marks in that station, and just they wanted to hear it that if we told each and every differential or not the serial. They were not bothered about the serial. And then the last station was another LCC. It was a case of thyromegaly and features of thyrotoxicosis in the history, and it was a very good station. They deducted only 1 mark in that station, and it was okay. And sir, regarding the findings, somebody told that there is exaggerated knee jerk, and I didn't tell the exaggerated knee jerk, but they didn't deduct any mark from any of us who told and not told. They were just looking for the diagnosis, that we were able to reach the diagnosis or not, by hook or by crook, by any means. They just wanted to know that single diagnosis from our mouth.
That center
Nothing else.
feedback is very good. Na? That center
Sir,
feedback is
excellent.
yeah,
Excellent.
excellent. Yes. It's very
Everything goes out so much smooth that we don't have to worry about time or any nothing, sir. No problem.
It's the same like Kochi center. Kochi, Thiruvanantpuram, these are the 2 best center in India, exam wise, including this Bangalore. So
Yes,
thank you
sir.
so much, Dr. Pranam, for coming.
Welcome,
And
sir.
okay, and
Sir, I'm
sharing.
very much, sir, I'm very much thankful to you, because my greatest weakness was LCC, and you just helped me out in that sector so much that my confidence was just top notch in the main exams.
The good thing is that you clear the exam. Okay, so it's very good, nice to see Dr. Pranam. So thank you so much,
Thank
Dr.
you.
Pranam. Okay, keep in touch.
Okay, sir. Yes, sir.
Yes. So
Stay
I
happy,
think
sir.
okay. Okay, thank you so much, Dr. Pranam, for coming today,
Okay.
taking some
Okay.
time. Okay. So I think Dr. Abdul Hadi, I think we must know about Almadi Center.
Assalamu alaikum.
Alaikum salam. How are you, doctor?
Alhamdulillah, Dr. Naseem, how are you?
Okay. Okay. So one doctor has already given about Kasarel, and now it's time for Almadi.
Yeah, okay. First, I'm Dr. Abdul Samir, one of Dr. Naseem al-Huda students. Alhamdulillah, I passed the basis diet 2 from Egypt, Maadi Hospital. First, I'd like to thank Dr. Naseem al-Huda. Really, without your guidance and continuous support till the day of the exam, I would not pass this exam. And I was lucky to be a student to Dr. Naseem al-Huda.
Thank you so much.
Also, I was really this. Also, I was lucky that Dr. Naseem al-Huda discussed with me the communication and the consultation cases of my exam in the mock before the exam. And seriously, I noticed that when Dr. Naseem al-Huda tell me, I'm with you till you pass, he literally means this. So really, many times I felt lost, but his patience encouragement, and the guidance made me feel I can do it. If you want me to talk about Egypt Center for candidates who will take the exam in Egypt, actually there are two hospitals in Egypt with different patients and different local examiners. So the exam in Egypt is always in 6 days, from Saturday to Thursday. The first 3 days are in Al Asr Al Aini Hospital, which is one of the Cairo University hospitals. So it's expected that the local examiners to be mainly from Cairo University, Faculty of Medicine, and the patient in clinical cases can be from the patient admitted in Al Asr Al Aini Hospital. So it's expected to find some acute clinical cases in Al Asr Al Aini as Guillain-Barré syndrome, but these cases don't appear in Al Maadi. Yeah. The last 3 days in Egypt is in Al Maadi Military Hospital. So
some candidate, doctor, just they want to know, there is a new center, means this Kasaral and something they changed the center, new or
no. It's only to Al Asr Al Aini or Al Maadi. Can be written in different names. Can be written in different names, but it's the same. First 3 days in Al Asr, second 3 days Al Maadi. Sometimes they write the military complex or write it in a different name, but it's always the local examiners in Al Maadi mainly not restricted only to military, but mainly from military doctors. And in this military hospital, they don't bring acute cases because they don't allow to bring patient admitted in the hospital to take him to the exam. So it's expected to find all patients are chronic only, and this chronic patient you may see in local clinical courses in Egypt with local mentors like Dr. Ahmed Maher or Dr. Ramadan in clinical courses there. But this doesn't mean, by the way, that Al Maadi is easier than Al Asr. In my opinion, I feel that the pass rate in Al Asr Aini is higher than Al Maadi from asking many colleagues. My recommendation for everyone, if you didn't apply for bases yet, apply as early as possible for bases and start studying after finishing part 2 written, as the knowledge of part 2 is still in your mind. And the most important advice, practice with your patient, focus on identifying physical signs, practice talking sessions with your colleagues, but with no doubt, supervised practice with a professional is highly recommended. So that's why I recommend the MOOC course with Dr. Nasim Al-Huda. He will identify your weak areas and guide you in a professional way how to improve it. Also, he will give you the expected cases in communication and consultation with the and will tell you what the examiner needs from you in the exam. Also, I recommend if you are going to Egypt, especially in Al Maadi Hospital, to take a mock clinical course 1 week before your exam in Egypt with a local mentor, as I mentioned, Dr. Ahmed Maher or Dr. Ramadan. And my best wishes for all of you. Thank you, Dr. Nasim Al-Huda.
Thank you so much. Keep in touch, doctor. Okay, nice. We will see you inshallah in Istanbul soon.
You are most welcome here.
Okay, thank you so much, doctor, for coming and taking your time.
Okay.
Okay. Thank you so much, doctor. So I think we keep Dr. Javeed waiting for some time. Dr. Javeed, are you there?
Assalamualaikum. I'm here.
Walaikum salam, doctor. How are you, Dr. Javeed?
I'm fine, alhamdulillah. Should I continue, or I can keep it for another day? I think
no, you can
more than
you
1
can
hour.
continue. No, no, no. We can continue. I think you are the last one. So Dr. Naima might not able to join. So
Okay.
I don't know. So better you should continue. So first of all, I would like to congratulate correct from all of us for passing this PACES exam. Okay. And you also passed from Thiruvanantpuram. So we want to know about you, that how you prepare, doctor, and what things we need to do as a candidate. Okay, so those candidates who are appearing in India, particularly Thiruvanantpuram center. So your experience regarding other centers also India. So just you share your feedback that how they should prepare, how they should approach, correct, so that everyone will pass this exam easily, doctor. Your opinion and experience about the exam.
First of all, I thank God for passing this exam. I thank for getting Dr. Nasim as my mentor. And the past 1 hour has itself shown that you have like candidates with centers in 3 different continents, in Africa, Europe, and Asia. So, so you have a quite a vast network, and many people are benefiting from your course. I always pray that you be blessed always. So regarding the center, I think it has been already very clearly explained that it's a very good center, and everything has been clearly mentioned. So, and coming back to the preparation, uh, I would like to clarify this is actually my 4th attempt. I had attempted 3 times, and 3 times I missed by 1 mark, 2 marks. The common, it happens as usual with many candidates. And uh, when I joined Dr. Nasim's course, actually, uh, he assessed what is my weakness, where he need to stress particularly, and he identified the specific areas. And in the one-to-one course, he stressed on one of the main area was that uh, the, as I am not from general medicine background, my history structure was not in a proper structure. Even though all the elements were there, they were not in the proper order. So he repeatedly made me revise it and practice it. And Alhamdulillah, I got 28 out of 28 in a long clinical consultation, thanks only to Dr. Naseem.
Thank you,
And
doctor.
then regarding the preparation, I'll sum up what has been already said, that try to do the exam as early as possible. The later you are doing it, the more effort you have to take. And as you know, rules can change anytime. You may have to change your preparation style. So start early. And then second thing, as everybody has already explained, this is not an exam of your knowledge. It's an exam of doing. So there is no point in hearing something and keeping in mind, okay, that's good, I will by heart it like 1 week before exam. No, you have to practice it. You have to keep on telling it. Uh, there is a particular way of asking question. There is a particular way of telling your diagnosis. So you keep on telling it, then it sticks to your mind. Like I can like maybe as a analogy, I can like you don't purposefully learn the lyrics of any new Hollywood song or Bollywood song. You hear it many times and you unconsciously by heart the line. So the same thing, you keep on asking the question. So you will not spend any time in thinking, okay, what I need to ask next. When the moment the surrogate gives you the answer, you will automatically ask the next question. So you will not spend any time thinking what to do or what to ask next. And the third thing, be relaxed. Uh, stay. I reached Thiruvananthapuram like 2 days before the exam, and 1 day before the exam, I went to the center and went to the exact floor and identified where it is, and then went back. And there is no point in studying on the day of exam. Be relaxed.
Right.
Yeah. In one previous attempt, the chief examiner from UK said one very striking thing. You just think that you are doing your routine daily clinical work. Don't think that you are in an exam. So just feel as if what you will be doing any other day. Like if the same patient came to your clinic with the same situation, there will be something that you will be doing quite naturally. So you will be doing some specific question, you will be ruling out something, and you'll be doing you'll be making a like a how to manage this patient. You will do this test, you will ask him for follow-up after this many days. So almost the same thing, but like modified little bit to the UK. And inshallah, you will pass.
So, Dr. Zabid, means anything like you told that you are appearing the fourth time. Okay. So, means what do you feel? What keep you motivated till now? Okay. Means because I see many candidates who miss the exam by 1 mark, so they feel very low. It's a common, it's a natural thing that everyone will feel low. But some candidate, they left practice, they do not try again, correct? Or do okay, so for those candidate, can you say something? Okay, means how they will keep themselves motivated.
I would say that request RTP for the feedback. So you will get the exact your answer sheet as evaluated by the both examiners. And when you read it, you will understand what they were expecting and what you missed. So as the doctors already have explained, they don't expect you to say the like 15 different causes. They want you to say the like most common or most reasonable things. And when you miss some such things, that cause that affects you badly, like you did not offer tissue or water to the crying patient, or you did not look at um, the plantar reflex. So there are some very striking errors that you may have done, and which you will be aware only when you read the feedback. And join a group, so somebody will support you.
Motivation is required. So group is good for this way. Means you will see other passing. Okay, some are others are also missing the exam. So you will be motivated if you are in the different groups. So there are many groups are there, no WhatsApp groups. Okay, many mentors are there. So you can join every mentor. There are the free sessions are there. Some candidate are passing. Okay, so you feel motivated and you keep on going. Correct.
Yeah, I agree.
Okay, so thank you so much, Dr. Jabir.
Thank
Any
you.
other tips you want to give? You are a very religious person also.
One tip is to join Dr. Naseem course and book in advance so that you get appropriate slot.
Okay, Dr. Javid, we'll meet you soon, correct?
Okay, sure.
We will meet again. Don't worry, doctor.
Sure.
Okay, so thank you so much. I think Dr. Naima, Dr. Naima, are you there? I think she is not there. Her cellular data is not working in Bangladesh. So I think thank you so much, everyone, all our candidate who passed the exam. So the takeaway message from this discussion, I think, is that this exam is doable. Okay, and means I know the all candidate, correct? Now when they started and now they are passing the exam, correct? Some candidate are there for 6 months with me. Some are there for last 1 year. I know the candidate, correct? So I have seen the changes in them, correct? So everyone will change after doing practice, correct? So after multiple times, do one case multiple times. Don't think that I know this case, so I should not repeat it again. No, this exam is all about repetition. The more you will repeat, in the stress you will remember, correct? So few scenarios are common, means cases are out. Everyone know that these are the cases coming in PACES exam. So as such, this exam is an exam of repetition, recalls, correct? Only thing is that you have to keep your nerve in control, and you have to practice multiple times. Clinical cases, it's very easy. Means in my view, all of you know the cases are out. Anyone can tell these are the respiratory cases. 5 out of 5, one will come to you, correct? Same like consultation. Don't think that you need to read 400, 300 cases. No, means 50 cases. If you prepared very well, and it will cover the different structures, different symptoms. Okay, and you practice it repeatedly, you can clear this exam very easily. And communication also, there are 10, 15, 20 structures are there. If you repeatedly practice that structure, so scenario might be changed, but you will able to manage it, correct? And you will able to manage the all 7 skills. Okay, so this is the takeaway message from here, because I know the candidate when they started and now they are passed, and I am talking to them. So few candidate, they are not able to complete the station. Okay, and now they pass the exam. It is all only the practice, correct? The theme is that the first thing after getting a seat is to not to select a mentor, to select a partner, correct? A study partner, that is the main thing. If your study partner is equal to you or better than you, it's a blessing, correct? You will gain a lot of, you can practice at your convenient time. And so this is the second thing, is the proper guidance. Okay, so there are many mentors there, you can select anyone. Okay, if you don't feel that one is not enough, you can go for that, because this exam is very costly, correct? You are spending a lot of money. Okay, so money also matters, as well as your time with your family members, your own time, correct? You are at the different stage of your career, you have a family, okay, and money also. So this exam, you have to arrange vacation, you have to travel also, correct? So nothing is in your hand. So I think better, once you get a seat, give your 100%, because you should and spend some money. uh, Easy means cheap courses like this. Okay, don't go for means courses that you can practice, correct? And then you will not able to, otherwise what you will have, if you will think that okay, I will not do a course, I will try first time. So what will happen, you will have to pay the fee again. Okay, again you have to pay fee. So that is the best way, is to do it at first time, try your best. Okay, and it's a doable exam, and 3 to 6 months of preparation, you can be prepared for this exam. Pass and fail, it depends upon not only your preparation, it depends upon the center, surrogate, luck, examiner, correct? So with a good preparation, many candidates are missing the exam by 1 marks, 2 marks. Some candidates, they are not well prepared, but they are passing the exam because that day their luck favors. Okay, so this is all about today session. So see you in our next session. So today I plan to have a consultation session, but time's already, I think, more than an hour. So see you tomorrow. Tomorrow, not maybe any day coming week. Okay, we'll have a our free session again. Okay, tomorrow I think there will be another free session in our group. Okay, so thank you so much everyone for joining our session today. If you have any questions, you can text me in the group also. General group is open. You can text, you can ask anything. So I will end our session. Thank you so much, everyone.
Thank you.
Again. The
Thank you,
candidates.
Dr. Nas.
Okay, thank you. Welcome.